Good afternoon. The first item of business this afternoon is portfolio questions. The first portfolio is rural affairs, land reform and islands. At question number 1, I call Liz Smith.
To ask the Scottish Government regarding any impact on agriculture, what discussions the Rural Affairs Secretary has had with ministerial colleagues regarding how to protect rural areas against fly tipping. Minister Jim Fairley.
I'm very glad that Liz Smith has brought this point up, because it's a really important issue, and the Government recognises the impact of fly tipping on rural areas and understands the pressure that this places on farmers. We are strengthening the enforcement and supporting rural communities through the National Litter and Fly Tipping Strategy. That includes SEPA working with local authorities to improve investigations and to develop guidance for landowners on relevant powers. A private landowners grant fund supported prevention and removal of fly tipping in the first 2 years of the strategy, and a Year 2 evaluation will be published shortly. And the Scottish Partnership Against Rural Crime and other partners are contributing through that rural strategy group.
Liz Smith.
Can I thank the Minister for that reply? He's been in the same meetings that I have sat through, where farmers in particular are making their very strong case that fly tipping is creating considerable difficulties for their businesses and productivity. Indeed, I suspect Mr Fairley knows exactly the areas in Perth and Kinross that I'm talking about. And sadly, he'll also know that Perth and Kinross Council and Fife Council too were in the 10 worst areas when it comes to fly tipping. I hear what the Minister has just said about the measures in place. Can I also ask, however, that when people are the people who know who it is who's undertaking the fly tipping, is he convinced, and are his ministerial colleagues also convinced that enough is being done to ensure that they are apprehended and properly dealt with?
Minister.
Again, I think because of the rurality of this crime, it's an incredibly difficult crime to get on top of. But we do have the National Fly Tipping Strategy. We've got to get better data on that. The data is critical, and there is work already underway to strengthen the national fly tipping data and improve the intelligence through the digital waste tracking and the new reporting powers that are within the Act. Tackling fly tipping supports that wider priorities, including rural crime prevention, waste crime, environmental protection and community safety, but it is definitely something that the Government are taking very seriously.
Thank you. Question 2, Michelle Thompson.
To ask the Scottish Government what assessment it has made of the Scottish Land and Estates report repopulating rural Scotland, including how the recommendations align with its current strategies to address rural depopulation.
Cabinet Secretary Mary Gousham.
This Government recognises the challenge of depopulation and is committed to working closely with partners to address it, with evidence highlighting that local communities are best placed to respond to their own distinct challenges. So we are therefore currently funding 7 councils to deliver Pathfinder projects which address population decline, and I think many of those actually align with some of the key areas that were highlighted by Scottish Land and Estates in their report. And building on that, Ministers will shortly consider options for a second phase and, where resource allows, expand delivery across a wider range of partners. We have also launched a non-statutory rural assessment toolkit to recognise the unique characteristics, challenges and opportunities of rural areas, and population retention and attraction is the overarching objective of our new National Islands Plan.
Michelle Thompson.
I thank the Cabinet Secretary for that response. At the roundtable discussion of the report, we agreed that a focus on rurality and their needs encompasses many different directors and supporting committees, but I'm aware from the work on my various committees that that doesn't always happen in practice. And as the Cabinet Secretary has pointed out, the clear accountability and monitoring of any initiatives the report itself said was very careful. But I wonder, how will the Scottish Government measure the success of its rural repopulation policies across all portfolios?
Cabinet Secretary.
Michelle Thompson raises some really important points in her question. What I would say is that we have the Ministerial Population Task Force that meets quarterly, and essentially at that group we agree cross-portfolio action around our population programme, and that includes the work that we're doing to address depopulation. In line with evidence, our response is ultimately led by local priorities and local communities, and that's why interventions across multiple portfolios, such as when we consider housing, childcare, skills, are being delivered by affected councils. Now, we have established tailored monitoring and evaluation approaches with each of those delivery partners to ensure that we are able to measure the initial outcomes that have been achieved. And currently, at the moment, we're undertaking an interim evaluation covering the first full year of delivery, and we will then consider the outcomes of that review as we look forward to phase 2.
Parliamentary Jamie Halker-Johnson.
Thank you. The Cabinet Secretary didn't mention transport, but the report referenced what it called patchy and inadequate transport as an issue in affecting depopulation. That's certainly something communities reliant on the Corran Ferry will recognise, with both vessels currently out of service. I was contacted this morning by an Agri constituent who said the area was struggling with supplies and services effective, and they raised concerns about elderly people seeing the care support they receive impacted from carers who use the ferry. So will the Rural Affairs Secretary raise this issue with her Cabinet colleagues and with her SNP colleagues on Highland Council and press them to reconsider the costly electric ferry option and ask them to look again at a replacement conventional ferry?
Cabinet Secretary.
I would just want to highlight that I recognise how important our basic infrastructure is in terms of retention of populations in rural areas and in island communities too. Again, I just listed some areas there. Housing is another area of critical infrastructure, but of course I recognise transport as well, as I've highlighted previously to the member. So, but I'm happy to raise the points that he's raised today with my Cabinet colleague, the Cabinet Secretary for Transport, and issue him with a further response.
Very brief supplementary, Emma Harper.
Officer. The cross-portfolio working is something that was mentioned by Michelle Thompson, and repopulation is really important, including Ford and Fries and Galloway area. I'm just wondering if the Government will have a continued commitment for this work after May 2026.
Briefly, Cabinet Secretary.
Of course, it's not for me to commit a future government in terms of the policies that could be brought forward, but what I would say is we absolutely recognise how important the work is that we're taking forward at a ministerial level through the Population Task Force. We have undertaken a number of projects, as I outlined in my response to Michelle Thompson. So, of course, we want to make sure that we keep that momentum going. We evaluate what's worked, what hasn't, so that we continue to tackle these problems.
Thank you. Question 3, Mark Ruskell.
Thank you, and can I apologise to the Chamber for needing to leave before the end of this question session. To ask the Scottish Government what progress has been made to update national guidance for local authorities on their responsibilities to uphold public access rights. Cabinet Secretary.
I recognise the importance of the guidance to access authorities in Part 1 of the Land Reform Scotland Act 2003. Now, it is a key document which outlines their roles and responsibilities, but I do acknowledge that it has been some time since that guidance was last updated, which is why I undertook, in response to, I believe, amendments from Mark Ruskell during the Land Reform Bill debate on the 28th of October, to discuss the process for updating it with those interested MSPs. Now, officials will need to properly consider the process and resourcing that's going to be required for a review, but once I have reviewed those options, my private office will contact those interested MSPs to discuss next steps from there.
Mark Ruskell.
Well, can I thank the Cabinet Secretary for that answer? I mean, it is clear that the updated guidance is long overdue. It was first drafted in 2003, and it is clear that some councils are really failing to adequately enforce the access rights in and around communities. One of those communities Cabinet Secretary will know is Burnt Island, and I know the Cabinet Secretary has recently met with Burnt Island Harbour Access Trust and has indicated her intention to meet with Forth Ports and Fife Council to hold them to account over the issue of long-standing issue of community access. Can I ask what progress there has been made under her leadership towards a resolution for that particular issue?
Cabinet Secretary.
First of all, I just actually want to thank members from Mark Ruskell and members across the Chamber, I think, for highlighting the issues that have been experienced at Burnt Island, because I think it was quite clear throughout the debate that we had on those amendments in land reform, just the strength of the feeling within the community, which is why I have really been determined since then to try and ensure we keep up the momentum and we do try and find a solution where possible that works for everyone. So, as Mark Ruskell outlined, I met with Burnt Island Harbour Access Trust in Burnt Island, which was a really helpful meeting to get some of the background to the situation, as well as to see the area we're talking about for myself. I am still due to meet with Fife Council and with Forth Ports, and we are currently in the process getting those meetings finalised, and I will, of course, I'm happy to keep members updated as to how those meetings progress, as well as Burnt Island Harbour Access Trust too, as we have those discussions, because I am keen that we find some form of resolution for the people of Burnt Island.
Supplementary, Tim Eagle.
Any debate around access right can get quite polarised, but the reality is huge amounts of people every year access our countryside, and it's done remarkably well. But sometimes where conflict does occur, I often find that the landowner is questioned, but the responsibility requirements of those accessing are not always pushed by local councils. If any update is to be done, will the Cabinet Secretary ensure that the Government takes into account perhaps new thinking on what responsible access means?
Cabinet Secretary.
One thing I would say is that I appreciate what Tim Eagle says about the polarisation, and sometimes when we talk about this, but I do think we were quite clear. I think Burnt Island is a perfect example, but I think we all came together to recognise that there were significant issues there, all parties across the chamber. But what I did undertake, and part of my response to that issue during the debate, was that I want to engage with members, and again I asked those who were interested to contact me about it. So again, if the member wants to be involved in that conversation, if he could contact my office and let me know, because I want to make sure we get the guidance right, and I'm open to having those discussions with anyone who has an interest in it.
Thank you. Question 4, Marie McNair.
Thank you, President Officer. To ask the Scottish Government how it's supporting forestry and Land Scotland to protect the Kilpatrick Hills.
Cabinet Secretary.
Forestry and Land Scotland manage approximately 3,500 hectares of land on behalf of Scottish ministers in the Kilpatrick Hills. Now, this is around 80% of the land loosely referred to in that area. Now, Scottish Water manages the reservoirs on the upper ground. It's comprised of both woodland and moorland, and it's managed for multi-purpose objectives, including social objectives and environmental too. Now, the area is well used by visitors for recreation, including mountain biking, and it also includes a section of the long-distance walking route, the John Muir Way. Now, the John Muir Way is the only formal trail, with other areas for walking being access roads and hill paths. The Scottish Government supports Forestry and Land Scotland through direct funding.
Marie McNair.
I thank the Cabinet Secretary for the response. I recently met with Forestry and Land Scotland and other stakeholders to discuss antisocial behaviour issues in the Kilpatrick Hills, such as the legal use of e-bikes and motorbikes on the trails. Litter, including remnants from the campfires, also poses a risk. I'm aware that campfire bans have been implemented within the Cairngorms National Park during the winter months. Can the Cabinet Secretary advise if this approach could be considered by Forestry and Land Scotland for the Kilpatrick Hills, and will she join me in calling out the antisocial behaviour in this area that's causing damage to our precious environment?
Cabinet Secretary.
Oh, absolutely. I couldn't agree more with Marie McNair on that point. But I think one thing I would have to make clear is that, well, Marie McNair mentions the powers that the National Park authorities have. Forestry and Land Scotland doesn't have those same bylaw-making powers, so it can't therefore replicate the actions that have been taken elsewhere to tackle some of these issues. Now, in terms of, I think, some of the specific matters that Marie McNair has raised, we are currently developing a wildfire strategy for Scotland, and through that we're going to be exploring and assessing any potential legislative options for seasonal restrictions on fire lighting, as well as considering the use of disposable barbecues, and drawing on the lessons that will be learned from the implementation of the new fire management bylaws in Cairngorms National Park. But I also just want to take this opportunity to thank Marie McNair and her team for their involvement in the current working group that's been established to coordinate the resources to tackle the issue of antisocial behaviour in the Kilpatricks that's affecting the local community that she represents.
Question 5, Pam Gossel.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on the progress Scotland is making towards becoming a good food nation.
Cabinet Secretary.
Scotland is making excellent progress towards becoming a good food nation. I'm delighted to note that the first National Good Food Nation plan was laid in Parliament this morning and published online today at noon. The plan reflects the feedback from the wide-ranging consultation throughout the development of the plan and the input from parliamentary scrutiny. This is an important stage of our Good Food Nation journey, and we will now turn our attention to the future development and implementation of the local authority and health board plans.
Pam Gossel.
I thank the Cabinet Secretary for that response. The Good Food Nation plan has become nothing short of a fiasco. Yeah. Whilst the plan has been laid, stakeholders do not agree with it and have concerns and questions around governance and accountability. The SNP promised that they would be a Good Food Nation by 2025, but what we see instead is a failure to deliver on, along with the neglect of food producers and limited effort on to make use of sustainable, widely available produce like venison. Does the Cabinet Secretary therefore agree that this is the case of the SNP over-promising and under-delivering?
Cabinet Secretary.
I just want to say, I respect Pam Gosal, but I have to say that what she's just outlined there is complete and utter nonsense in terms of our Good Food Nation plans, as well as...
Can we listen to both the questions and the responses in a respectful manner? Cabinet Secretary.
Thank you, Presiding Officer. Again, we've published our Good Food Nation plan today, the first of its kind. Scotland is world leading in the work that we are doing to become a Good Food Nation in Scotland. The plan underwent a great deal of scrutiny from a number of committees in the Scottish Parliament. All of that has been taken into consideration in the plan that we've brought forward. Now, of course, we need to implement that plan. We recognise that. We know it's important. And it's the job of every minister across government in all the different portfolio areas to work towards delivering those outcomes. Now, Pam Gosal also touched on a number of different areas there that are critically important. The role of our farmers, the role of our food producers, and we want to make sure that more people in Scotland have access to that. And that's a fundamental point that's made clear in our Good Food Nation plan. There's so much work that the Minister for Agriculture is taking forward in ensuring that people have access to some of the foods such as venison and deer control. We've been talking a lot about through the passage of the Natural Environment Bill too. So there is work ongoing on all these fronts, and I look forward to continuing to deliver our first National Good Food Nation plan.
Thank you. Please supplementary, Rhoda Grant.
Thank you, Presiding Officer. The Rural and Islands Committee voted against the Good Food Nation Specific Functions and Descriptions Regulations 2025 on the 3rd of December. Can I ask if the Cabinet Secretary has now decided to change that legislation to meet the ambitions of stakeholders to have a Good Food Nation plan that covers all aspects of food, including agriculture and fisheries, which was missing from the instrument, or is that actually the reason why members of ARIOB are now resigning?
Cabinet Secretary.
In relation to the statutory instrument, I'm of course disappointed that the committee didn't support that affirmative piece of legislation at the recent meeting where it's discussed. So the statutory instrument has since been withdrawn. So of course we will continue to consider and engage with stakeholders as we have always done. But I think, and what I hope I was able to actually outline during the committee appearance that we had when we were discussing that statutory instrument, is the fact that some stakeholders wanted a broad brush approach when it came to the specified functions and the specified descriptions. However, if we have too broad an approach and we just cover one generic policy area, it will not deliver the outcomes that I believe we all want to see, which is to have that difference, to have that physical consideration by other portfolios across government to ensure we're delivering on the outcomes of the plan. So I think what I can commit to today is that we'll continue to have those conversations, and of course if changes need to be made we'll consider that. But again, we'd set out that approach for, I believe, a very good reason that would have then enacted and delivered the outcomes of the plan.
Question 6, Sarah Boyack.
To ask the Scottish Government, in light of the recent Scotland Futures report, which found that 96% of respondents believe that changes are needed regarding how land is owned and used, what steps it will take to ensure that the land reform goes further than the current Land Reform Scotland Bill does to deliver land justice?
Cabinet Secretary.
First of all, we welcome and we are considering the findings of the Scottish Land Commission's Scotland Futures report. Now, the recently passed Land Reform Scotland Act represents a significant step forward in the land reform journey and delivers tangible improvements, including lotting provisions and land management plans. Now, plans for implementation of the Act are being developed, and we will continue to consult with stakeholders to ensure that the provisions are as impactful as possible. Alongside this, we are progressing work on other policy areas too. That includes the community right to buy, compulsory purchase and considering compulsory sales orders, addressing vacant and derelict land and exploring the role of taxation.
Sarah Boyack.
Can I say I'm glad the Cabinet Secretary is reflecting on what changes can further be made. But after the Land Reform Bill was passed, many stakeholders and community groups were disappointed with the Scottish Government's refusal to apply the lotting and public interest powers of the bill on a nationwide basis. And as land justice is a nationwide issue, does the Cabinet Secretary agree that this needs to apply to land on a nationwide scale so that constituents across the country are not going to miss out on these crucial powers?
Cabinet Secretary.
I appreciate the point that Sarah Boyack raises, but again, I believe the measures that we introduced and that Parliament passed, first of all, we brought forward those measures based on the evidence that we had, and of course we need to make sure we have that evidence base when we're bringing forward policies or proposals to ensure that they will work when they're implemented. And again, I think that's where we need to actually bear in mind, I think, just how significant some of the proposals that we introduced in the Land Reform Act are. But of course, the key to that and what's going to be critical is the implementation of that. There were amendments that were passed during the stage 3 of the Act that I think Martin Whitfield's in particular about the review, because we need to make sure we're monitoring and that we're learning lessons from the Act as it continues and as it's implemented, so that we can only then look to improve and build on the measures that have been introduced.
Thank you. Question 7 is withdrawn. Question 8, Liam Kerr.
Thank you, Presiding Officer. To ask the Scottish Government how many farmers in the North East Scotland region have applied for the Future Farming Investment Scheme this year, including how many of those were successful?
Mr Kerr, I think you haven't read...
Agricultural data are not collected for the North East Scotland electoral region, since these data are not collected on the basis of Scottish parliamentary electoral regions. The Inverurie Rural Payments and Inspections Directorate Agricultural Area Office region, which covers the North East area, received 1,138 applications, consisting of 703 applications that were eligible, 433 applications that were assessed as not eligible. There are a total of 326 applicants in this area were offered a grant, and there is a central mailbox for queries from unsuccessful applicants is being provided.
Liam Kerr.
Well, it seems that I'm better informed than the Minister, because I have the data, and I can tell him that in the North East, 85% were rejected. Nationwide, the scheme received over 7,500 applications, but nearly half were ruled ineligible. But the scheme gave no reason for rejection to applicants. It offered no right of appeal, and it looks like a government over-promising and under-delivering. Now, as the SNP voted down Scottish Conservative proposals which would have seen the scheme reviewed, reported on and transparency provided to applicants, will the Minister consider reopening the scheme? And if so, how will he ensure more small farms are successful and those that aren't understand why?
Minister.
No, we won't be reopening that scheme, but we will be shortly publishing details of how the applications were assessed and giving information on why some applicants were not successful. And as I've said, they can, members of the public can contact the Rural Payments and Inspections Directorate Area Office mailbox to seek general guidance and feedback on their application.
Supplementary, Mercedes Villalba.
Thank you, Presiding Officer. Farmers in the North East have expressed concern the Scottish Government are dragging their feet in reforming and rebasing agricultural support, like the Future Farming Investment Scheme and the Less Favoured Area Support Scheme. This cheats young farmers out of a fair deal and prevents small-scale, environmentally friendly or regenerative farming in less favoured areas. I recently asked the Minister whether future support for less favoured areas will be based on contemporary or historic data, but I didn't get an answer. So can I ask again, will he ensure that future support will be based on up-to-date information and data?
Minister.
And as I said to the member the last time, all of these things are being discussed and looked at in the round as we take our systems forward. But I absolutely take the point on board that we absolutely have to make sure that we are giving farmers the tools that they need and the certainty that they require. Unfortunately, we don't have any certainty from the UK government, who have just brought in the inheritance tax problems. They haven't done anything to change the systems down south. They have barnetised the farming fund that is coming to Scotland, and they have taken away the ring fencing. So I'm afraid there's under no circumstances can we take any lessons from the Labour Party on how to support farmers here in Scotland. A government that has maintained direct support, that has maintained voluntary couple support, that has maintained the LFAS payments, that has put in a number of different schemes to make sure that we are protecting the farmers in Scotland, unlike either that lot or that lot over there.
That concludes portfolio questions on rural affairs, land reform and islands. There will be a brief pause before we move to the next item of business to allow front benches to change. Okay, the next item of business is portfolio questions on health and social care. Just to advise the Chamber there is a lot of interest in supplementaries. If I'm to get through them, I will need brevity in questions and indeed responses. Call question number 1, Hamza Youssef.
To ask the Scottish Government what action it is taking to address the health impacts of loneliness.
Minister Tom Arthur.
We recognise loneliness can affect anyone with negative impacts on health and well-being. It can be particularly difficult at this time of year. Our social isolation and loneliness strategy and delivery plan are supported by a dedicated 3-year fund providing £3.8 million to 53 community projects across Scotland. This is complemented by our £81 million investment since 2021 in the Community's Mental Health and Wellbeing Fund for Adults, including over 4,500 projects focusing on reducing isolation and loneliness. Our Mind to Mind website and campaign also encourages people to talk to others about how they are feeling.
Hamza Youssef.
Can I thank the Minister for that comprehensive response? And he references the important health impacts that loneliness can have on an individual. It can quite literally be a killer. And we know that thousands of Scots, many in our elderly community in particular, will face the festive period alone. That's why the work of community groups like Swamp in my constituency are so vital. From their Fun Day Fridays through to Christmas lunches, craft workshops, Swamp ensures that our elderly know that they are always part of a community. Yet so many organisations like Swamp are facing financial challenges. Can the Minister confirm that he acknowledges the important role the third sector plays in tackling loneliness, a cost, of course, which would otherwise be picked up by the NHS? And will he reflect that point in budget conversations he's having with the Finance Secretary in the run-up to the Scottish Budget?
Minister.
Can I thank Hamza Youssef for raising this important issue and join him in recognising just how vital community projects are in helping to reduce isolation and loneliness for people across Scotland. Indeed, on Tuesday I saw the good work of the Willowacre Trust in Cowlairs, Glasgow, which helps people of all ages to connect. And this is just one of thousands of projects being supported through our Community's Mental Health and Wellbeing Fund. And with regards to looking towards the budget, recognising the pressures facing the third sector, we are seeking to extend multi-year funding arrangements. And I'm delighted as part of that, the Fairer Funding pilot, we have already committed a further £15 million to our Communities Fund next year.
A couple of brief supplementaries. First, Anders Gulhani.
Thank you. Declaration of Interest as a practising NHS GP. For many people, Christmas is a time to enjoy precious moments with family and friends and reflect on the past year. However, for too many Scots, Christmas is a period of social isolation, loneliness, and something I know all of us in the Chamber care about deeply and want to address. We have fantastic organisations across Glasgow and Scotland that provide vital support, like SAMH in providing Nooks and the Samaritans, who I would encourage anyone who is struggling with low mood to reach out to. Now, these organisations do require adequate financial support to deliver their essential services, and I wonder if the Government would be able to discuss with SAMH, look at the work they're funding through their Nook, and maybe expanding that further through governmental funding.
We'll need greater brevity, but Minister.
Can I thank Dr Gulhani for his question and the important matters he raises. I say we are actively engaged with SAMH. Indeed, I had the privilege of visiting the Nook just a few weeks ago in Glasgow and was hugely impressed. And these are exactly the kind of interventions we want to see more of in Scotland to play a vital role. And I would want to commend SAMH and many other organisations who will be providing vital support, not just at this time of year, but all year round.
And briefly, Paul Sweeney.
Thank you, Deputy Presiding Officer. The Right Honourable Member for Glasgow Pop mentioned an excellent example in our city, and also it was great to hear the Minister visited the Willowacre Trust. And of course, this is critical at this time of year because around 60% of Scots over the age of 50 experience loneliness most or all the time, particularly this time of year. And the concern is that local organisations are so precarious in terms of funding that they don't know from one year to the next if they will be able to continue those services. I think of another example of the Alive and Kicking project in Springburn, which are putting on a special Hogmanay party for elderly people in the Springburn area. But they've just been through a hugely onerous process of securing 3-year funding. Can the Minister do more to work with health and social care partnerships to really identify why this is really beneficial from a public health perspective?
Minister.
Make sure that's reflected.
The member raises really important points around security of funding and the importance of that for enabling organisations to plan strategically. That's exactly why we have the Fairer Funding pilot, and with the Communities Fund that I made reference to in my earlier answers, that is why we've committed that funding already for next year. But I do undertake in my routine engagements with health and social care partnerships to convey the points that the member makes, because I think they're well made and they're good points.
We will need greater brevity in the questions. Question 2, Keith Brown.
To ask the Scottish Government, in light of the population being expected to age rapidly over the coming decades, with more than 1 in 5 people soon to be of pension age, what measures it is taking to adapt health and social care provision to meet increased demand?
Mr Tom Arthur.
Through our service renewal framework and population health framework, we have set out a long-term approach to reform for the reform and renewal of health and social care in Scotland. These frameworks prioritise prevention and early intervention to reduce future demand. We will guide national planning for changing demographic needs while tackling health inequalities, ensuring services remain sustainable and responsive for the whole population. Implementing these changes will deliver significant improvements in how people of all ages access and experience care and support across Scotland.
Keith Brown.
Can I thank the Minister for his answer? I just wonder what role he sees, though, for emerging technologies such as AI-assisted care planning, digital monitoring, robotics and telehealth in transforming health and social care for an ageing population. The Minister will be well aware that Scotland has a uniquely long and substantial body of data in terms of its healthcare and the integrity of that data. What consideration is being given to the workforce skills required to support these kind of technologies, including the role of colleges in delivering the training and opportunity that should exist for institutions such as Forth Valley College, to work in partnership with the local health board to deliver these changes?
Minister.
Can I thank Keith Brown for raising these important issues, and I want to assure them that the Scottish Government views emerging technologies as key to a digital-first approach. As outlined in the Service Renewal Framework, telecare, remote monitoring and digital prescribing will improve access, efficiency and integration, supporting care closer to home for an ageing population. These innovations will, of course, require a workforce with the necessary training and digital tools, and we will work with academia and industry to help ensure our workforce is appropriately resourced with the necessary skills as new technologies and innovations emerge.
Brief supplementary, Carol Mochan.
Thank you, Presiding Officer. I welcome the fact that people in Scotland are living longer, but we know they aren't always living in good health for longer. In East Ayrshire, my South Scotland region, it's estimated the total burden of disease increased by 2.6% between 2016 and 19. So I wondered if the Government could provide an update on the targeted work it is doing to promote healthy living across Scotland, but particularly in our more deprived communities.
Minister.
This is a really important point because, of course, we're not just concerned with life expectancy, but healthy life expectancy. And that's why that is a key component of our population health framework. So I want to assure the member and the whole chamber that this is a priority for the government.
And question 3, Jackie Dunbar.
To ask the Scottish Government, following NHS Domestic Abuse Awareness Day, which took place on the 10th of December, with the aim to shine a light on the high prevalence of domestic abuse affecting healthcare professionals, how it is supporting NHS boards to ensure that they have robust domestic abuse policies in place.
Cabinet Secretary Neil Gray.
Presiding Officer, domestic abuse is a violation of human rights and is totally unacceptable. The Scottish Government is committed to ensuring that NHS boards have robust domestic abuse guidance in place to address this issue. All boards are required to implement the national NHS Scotland gender-based violence workforce policy, which aims to provide sensitive and confidential support to employees that disclose that they are affected by domestic abuse.
Jackie Dunbar.
Can the Cabinet Secretary outline how the Scottish Government's Equally Safe strategy is supporting NHS boards like NHS Grampian to tackle gender-based violence?
Cabinet Secretary.
Officer, our Equally Safe strategy sets out a vision to prevent violence from occurring in the first place. It builds on the capability and capacity of support services and strengthens the justice response to victims and perpetrators. The role of the Equally Safe strategy is to define violence against women, set out the scale of the problem and an agreed approach to addressing that problem across spheres of government and across the statutory and community and voluntary sectors. Its vision for change recognises that NHS boards are at the heart of this. So within Equally Safe, Safe delivery plan, there are a number of commitments which are aimed at supporting health boards, and we're working with a range of partners to improve the training on all forms of violence against women for staff, including the health workforce. And that delivery plan also outlines the work we are doing with partners to continue to raise public awareness of NHS sexual assault response coordination services and promote updated guidance for healthcare professionals on how to respond to disclosure of rape or sexual assault.
Supplementary, Jackie Bailey.
I'm sure the Cabinet Secretary will welcome the announcement by the UK Government of specialist NHS support for domestic abuse and sexual violence survivors. It is essential to have trauma-informed specialist healthcare pathways, as their needs often fall between criminal justice, health and safeguarding systems. So can I ask the Cabinet Secretary if he is considering adopting a similar approach, given the recent concern about grooming gangs?
Cabinet Secretary.
Sexual assault and any form of sexual violence is completely unacceptable, must not be tolerated, and it's obviously incumbent on boards in the first instance to ensure that their staff and patients are supported to be able to report that when it takes place. Of course, I welcome any steps that are taken in any jurisdiction to improve the situation for people who are the victims of sexual violence or indeed domestic violence to be able to report, and for the police to be able to respond accordingly. And I'll make sure I responded writing to Jackie Bailey as to the steps that we've taken here in Scotland.
And question 4, Brian Whittle.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what consideration has been given to the role of the third sector in ensuring the sustainability of the NHS.
Minister Secretary.
Presiding Officer, we recognise the essential role played by the community and voluntary sector in supporting communities across Scotland and supporting the delivery of the Scottish Government's priorities. Community and voluntary partners are embedded across all aspects of government policy, and the importance of the sector is reflected in our vision for public service reform and population health. As Mr Arthur has set out earlier, we acknowledge that the sector needs stability and the opportunity for longer-term planning and development to support its sustainability and the ability to continue to meet the needs of communities longer term.
Brian Whittle.
I welcome the Cabinet Secretary's support for the third sector, because in many manifestos, including Voluntary Health Scotland, they call for the third sector parity in service commissioning. This is crucial for NHS sustainability. For example, Morven Day Services in my region receives no HSCP funding despite delivering nearly 11,000 hours of peer support, therapy and activities since January, worth £170,000 if billed. Like many third sector organisations, it faces closure next year without long-term sustainable funding. So does the Cabinet Secretary agree that losing such services would further strain an already unsustainable NHS? And how will it ensure sustainability of crucial community services such as modern day services?
Cabinet Secretary.
Presiding Officer, I thank Mr Whittle for raising the concerns of what appears to be a very strong community organisation in his region that provides support to people in the community, but also undeniably support for health service as well. I routinely ensure that my very clear desire to see that partnership working that I've spoken about, that Mr Arthur was speaking about in terms of longer-term sustainability, is absolutely embedded not just within health boards, but I expect within IGBs as well, although I don't have the same locus in our IGBs as I do within our health boards, and actually that some of our community and voluntary organisations can reach people and provide services that our statutory organisations often can't. And so we should be looking to ensure that we are providing that mix and ensuring that we're supporting such well-run organisations to support our people and move through to the more preventative activity and the better population health that comes through from the population health framework.
A couple of brief supplementaries. First, Rona Mackay.
Thank you, Presiding Officer. I'm sure Mr Whittle recognises that asking for sustainability in our NHS means voting for it, and he and his colleagues didn't vote for the record funding this SNP Scottish Government delivered for our health and social care system in 25-26. Will the Cabinet Secretary join me in calling on the Tories to recognise the profound positive impact which the over £21 billion of funding for the health and social care this year alone has delivered for the people of Scotland while they sat on their hands?
Cabinet Secretary.
Presiding Officer, I agree. We are making good progress transforming Scotland's health services. Last year we delivered a record number of hip and knee operations. Long waits over 52 weeks have reduced for 5 consecutive months, and we performed more operations that were at the highest level since January 2020. That's thanks to the tireless work of our outstanding NHS staff. We are also delivering thousands more appointments and procedures this year and seeing downward trends across nearly all waiting list indicators. Health is at the heart of our budget, which provided record funding of £21.7 billion to health and social care. And to protect the NHS's long-term future sustainability, we plan to invest in a range of reforms, including shifting care from acute to community settings and investing an additional £531 million in general practice over 3 years and expanding hospital-at-home capacity to 2,000 beds, to give just 3 examples.
And very briefly, Neil Bibby.
Last week I met staff and volunteers at Accord Hospice who run the Renfrewshire Bereavement Network. The network provides vital support to people who are experiencing loss or dealing with grief. It is free at the point of use and works with minimal wait for people. Despite the high demand for their service, they are concerned about no secure commitment to funding from the Health and Social Care Partnership, potentially putting the service at risk. This is exacerbated by a 7% reduction in overall hospice funding from Renfrewshire HSCP this year. Does the Minister agree with me that organisations like Accord Hospice are best placed to deliver these specialist services, and we should do everything we can to protect them and their funding?
Cabinet Secretary.
Presiding Officer, as Mr Bibby will know, these are decisions that are rightly locally made and need to be so, but I am very familiar with the work of Accord Hospice, as I am the Hospice Network, and I am in the fortunate position of having a remarkable hospice in my constituency as well. So I recognise and understand the invaluable contribution that we make, and of course I would encourage all of our health boards and IGB partners to support the Hospice Network. That's why we have invested additional money and resources into hospice funding, to give that support for pay parity, for example, and why we'll continue to work with the sector. So whilst not directly commenting on the individual case that he raises, for obvious reasons around local decision making, I hope that gives him some assurance as to the government's support for the sector.
Question 5, Paul McLennan.
To ask the Scottish Government what discussions it has had with the Royal College of Psychiatrists in Scotland and its proposal of the future of provision for neurodevelopmental conditions.
Mr Tom Arthur.
The Scottish Government welcomes the Royal College of Psychiatrists report on future provision for neurodevelopmental support in Scotland. I agree that demand for neurodevelopmental assessment and support now far exceeds what Scotland's mental health infrastructure can deliver, and that a different response is needed. The Scottish Government is committed to driving forward improvements to address this complex issue. To support us in this work, the College is a member of our Children and Young People's Neurodevelopmental Task Force and also participated in the cross-party summit on neurodevelopmental support that I hosted on the 15th of December.
Paul McLennan.
I thank the Minister for the answer. The summit brought together people from clinical services, education, local government, academia and policy. Can I ask what key points from the summit were raised? And can I also ask what the voice of those with lived experience will be heard in this regard, and where it will be influenced policy moving forward?
Minister.
Can I thank Mr McLaren for his question? At Scotland's first summit on neurodevelopmental support on 15 December, the focus was on improving our shared understanding of the complexity of neurodevelopmental needs and the actions required to improve access to timely, consistent and neuro-affirming support. I was pleased there was political consensus on a number of issues, and I am considering how we take this forward. Lived experience was generously shared by neurodivergent attendees, and I will continue to ensure that neurodivergent people, their families and frontline staff continue to inform and shape our policy approach.
And very briefly, Willie Rennie.
But 30% of adults live in parts of the country where they're unable to get a neurodevelopmental assessment. So it's not as if demand is outstripping the supply. There is no supply in many parts. So why wouldn't the Minister treat this much more urgently than he currently is? Because this is an urgent situation.
Minister.
I would want to assure Mr Rennie I treat this matter with the utmost urgency, and I was very grateful to his colleague Alec Cole-Hamilton for participating in the summit on Monday, and indeed recognise that that summit arose out of a commitment from the government secured during a debate that the Liberal Democrats demonstrated. This is an area where I really want to build political consensus. I think that was evident at the summit on Monday, and I'd be more than happy to engage directly with the member on the picture nationally or locally, but I would want to leave him in no doubt the priority that I attach to this matter.
Thank you. And question 6, Emma Roddick.
To ask the Scottish Government how it is supporting the work of community first responders.
Mr Jenny Mint.
Presiding Officer, Scottish Ambulance Service community first responders play a critical role in saving the lives of people across Scotland, and I, and indeed the Scottish Government, support them wholeheartedly. The Scottish Ambulance Service has full operational responsibility for community first responder schemes, and in 2025-26 the Scottish Government increased the Scottish Ambulance Service budget to £437.2 million, an increase of £88 million on the last year, which will see continued investment in these almost 150 life-saving schemes.
Emma Roddick.
I thank the Minister for that answer. Community first responders in the Highlands and Islands are crucial and often bridge the gap when it comes to difficulties with distance or resourcing in rural and island communities. However, many have reported to me that barriers to carrying out this role are increasing with time, from difficulty securing the correct insurance to being unable to access training courses or administer emergency medication like EpiPens. Can the Scottish Government do any more to support these vital volunteers?
Thank Emma Roddick for her follow-up question, and I absolutely recognise the importance of community first responders in our rural and island areas. I had the pleasure of meeting with some based on Isla at the Isla Jura and Consley show this summer, and I absolutely recognise the importance of the roles that they play. I am also hosting a round table in January, specifically around out-of-hospital cardiac arrests, which will include both the Scottish Fire and Rescue Service, Police Scotland and the Scottish Ambulance Service. I think it's important to recognise that when community first responders are responding to the calls, they are covered by Scottish Ambulance Service insurance, and some schemes with support of their communities have developed beyond the core model and secured their own vehicles and equipment and funding. They understand it's their responsibility to source business cover and suitable training. If the member would like, I'd be happy to meet with her.
Thank you. Very brief supplementary. Faisal Chowdhury.
Thank you, Deputy Presiding Officer. Bleed kits ease pressure on first responder by allowing bystanders to prevent a potential fatal loss of blood while they wait for responder to arrive. However, there are nowhere near enough bleed kits in Scotland. Please, can the Minister explain what the Scottish Government is doing to increase the number of bleed kits in Scotland?
Thank Faisal Chowdhury for his question and recognise the importance of the question and the importance of bleed kits across Scotland. It's something that I've been speaking to a number of people about and would be very happy to follow up in writing to Mr Chowdhury.
Thank you. Question 7, Claire Hawley.
Thank you, Presiding Officer, and I remind Chamber I'm employed as a bank nurse by NHS Greater Glasgow and Clyde. To ask the Scottish Government how it is supporting NHS boards in light of the increase in hospital admissions of people affected by influenza.
Cabinet Secretary.
Presiding Officer, one of the most important things that we can do to support NHS boards is make sure people stay healthy and only attend hospitals when it is absolutely necessary, but also our vaccination programme is vital in tackling flu this season, and we work closely with boards to make vaccination as accessible as possible, supported by national resources and funding initiatives like mobile vaccination units. Our nationally funded programmes, such as virtual hospitals and flow navigation models, also support boards to enable people to get the right care in the right place and reduce unnecessary visits to A&E.
Claire Hawkey.
I thank the Cabinet Secretary for that answer, and as he referenced in his answer, we know that one of the best ways of preventing influenza infection is to get vaccinated. How is the Government supporting health and social care staff to increase their uptake of the vaccine this year?
Cabinet Secretary.
Presiding Officer, I thank Claire Hawkey for her question because, as one of my last contributions before Christmas, it offers me the opportunity to wish you and other colleagues a Merry Christmas, but also, most importantly, thank our staff across health and social care for the service and sacrifice that they will be giving over the festive period. It is greatly appreciated, I believe, by all of us, and I hope I speak on behalf of the whole Chamber in doing so. Additional measures have been introduced this winter to boost uptake among health and social care care workers, including digital prompts and tailored communication materials to encourage vaccination. I, along with the Chief Medical Officer, have written to system leaders requesting continued support in making access easy for staff, and most health boards now provide peer-to-peer vaccination in workplaces and drop-in clinics for convenience. And the programme is also working with professional bodies that reinforce the message through blogs and social media, and uptake in these vital groups continues to rise as the vaccination programme progresses, reflecting strong collaborative efforts. But the message is clear: protect yourself, your loved ones and our services this winter by taking up the vaccine if you're eligible.
And question 8, Patrick Harvey.
To ask the Government what criteria will be used to evaluate its pilot programme for walk-in GP clinics, including whether stakeholders representing GPs and other health professionals will have been involved in defining these criteria.
Cabinet Secretary.
Officer, the Scottish Government will evaluate the walk-in service pilots, drawing on the clear set of characteristics used to select proposals in the first instance. These include areas such as impact on access, patient experience, wider system performance and overall cost effectiveness and scalability. These characteristics will underpin the national governance and evaluation frameworks for the pilots, and GPs and other stakeholders have been involved in shaping this work to date and will continue to be closely engaged as the pilot programme is established and evaluated.
Patrick Harvey.
More or less as soon as this policy was announced, it received significant pushback from GPs and other health professionals, not only saying that it was going to be a poor investment, but that it could actually risk worsening health inequalities. And as far as I'm aware, the BMA only had the opportunity to discuss the issue the day before it was announced, and the Royal College of GPs 2 days after it was announced. So they haven't had the opportunity to shape the government's thinking. As far as I'm aware, they're not having the opportunity to shape the evaluation criteria either. So how can the Cabinet Secretary assure us that the expertise of the people delivering these services will be taken seriously, and that GP services will be treated as something more important than a conference gimmick?
Cabinet Secretary.
Presiding Officer, I think the widespread welcome that there has been from members of the public as to the policy announcement serves as a testament to the popularity of the policy. I have engaged directly with both the BMA and the Royal College of GPs. I understand their concern, both in terms of continuity of care and the potential for health inequalities to be exacerbated. I'm wanting to make sure that the reverse is true, that actually we can seek to address health inequalities through GP walk-in clinics, and that we can make our services more accessible and flexible for people to use and have the continuity attached to it. That's why I continue to insist on the involvement of not just boards but also GPs in the design and the evaluation of the system.
Thank you, and with apologies for those I wasn't able to call, that concludes portfolio questions on health and social care. There will be a brief pause before we move to the next item to allow front benches to change.